Good evening and welcome to the Cure HHT webinar series. I am Nicole Schaefer, Director of Professional and Medical Programs for Cure HHT. Welcome to this evening's webinar, HHT, There's an App for That. Just a few reminders, tonight's call is being recorded and will be posted on our website. After the webinar, you will receive an email with a short survey with specific questions about the functionality of the HHT app. Your input is critical to the development of this tool. To help reduce background noise, everyone's phone or microphones are muted. To ask questions throughout the webinar, go into the gray panel on your screen and type your question. I will ask as many questions as time allows during the second half of the call. We will be asking you a poll question at the beginning and the end of the webinar. Please take a second to respond to these questions. And ask general questions related to tonight's topic so the answers will benefit everyone on the call. Now it is my pleasure to introduce Dr. Jeffrey Terrell, who received his medical degree from Harvard Medical School and received his training at Massachusetts Eye and Ear Infirmary. He is currently a professor in the Department of Otolaryngology, Head and Neck Surgery at the University of Michigan, where he has served on the faculty for 23 years. Dr. Terrell is board certified in otolaryngology and medical informatics and is a full-time rhinologist who has been treating HHT patients his entire career. We are grateful for Dr. Terrell's insight into the needs of HHT patients and his desire to meet those needs through the development of an HHT app. I now pass tonight's program over to Dr. Terrell.
To be exciting to be here, and I want to thank the Cure HHT organization to allow me to be here and talk about this and work with the Cure HHT organization on an app. It's a great organization. I've really enjoyed working with you all. I have been working now for several months along with a medical student whose name here is Seth Klapman on an app for HHT along with the Cure HHT organization. I think my picture may be on your screen, and if you want to minimize me and put me off to the side, you're certainly welcome to do that if it's distracting. Sometimes it is. But I'd like to talk about an app for HHT, and let me just make sure my slides are moving. I'll talk a little bit about the background, why is a good time for HHT app, and we'll talk a little bit about the design for the app for patients, and then some of the features of the app as well. We'll talk a little bit about how Cure HHT is raising money for this, and then have a lot of time, I hope, for some discussion. I'm not going to get into way down in the weeds in the real details of the app because that's what the work is for the future. But the time is really right now for an app for HHT patients for many reasons, but I'll go through sort of four major categories. One is we have the Cure HHT organization, a very engaged community of patients and the entire organization that's interested in this disease, and in particular the organization helped to pull this together. We have the educational content through the organization and through the literature and other scientific publications. But importantly, we have this guideline that was produced several years ago that is out there and serves as a nice starting point for an app, so that we can be sure the app is guiding people in the right direction. You all know, as I think for the most part many patients online here, that this is an important disease. There is significant risk for patients, especially if they have undiagnosed manifestations of HHT. It's not a particularly common condition, so I think you'll find that there are a lot of primary care doctors and specialists who have minimal knowledge, sometimes no knowledge, occasionally some advanced knowledge about this disease. So I always think it's important for a patient to understand the disease well if it's not an uncommon disease. So having the patients really involved by hopefully educating through the app as well as other means, I think is important. I'm excited as an ENT doctor that there have been some significant breakthroughs in the treatment for HHT. 20 years ago, the nosebleeds were hard to manage. We had a number of things, but I think there are better treatments now for nosebleeds. and educating patients, I think, makes a difference. From a technology standpoint, things have really changed a lot in the last, even the last year. Apple's come out with a number of different technologies to help build apps, and think of them like a toolkit. And Apple has it's called a Care Kit, which makes making an app substantially easier, making an app like this substantially easier. Less cost of development, and they really have figured out the privacy and the security Apple has, and so they really are leading in healthcare apps. A lot of it because of the privacy and security things, which of course is important to everybody. And then we all know that people are using mobile phones, increasingly throughout the entire world. Even sub-Saharan Africa has a lot of apps, certainly, and a lot of medical apps. So we know that they're out there. They have fairly proven viability in terms of the apps helping change behavior and improve health. But the apps can really allow us to deliver health care information and even some interventions to a large number of patients. And we can even customize the message that patients are getting depending on what type of HHT manifestations they have. And it really, compared to other interventions, it's pretty low cost, distributing an app. So we really help one to connect patients to the healthcare team better using an app, and maybe patients sort of networking amongst themselves. So there have been a lot of apps out there. So what's the background? Are there apps out there? There are a lot of medical apps out there of varying quality. Care Kit, with the Apple's product, has some of the best apps out there, I think. But there are many apps, and some people even call it the App Orchard. Some companies have the App Orchard. But in terms of the background, again, the technology is there. In the top left, you can see a lot of the technology, web services, and the networks, and the cloud storage of data in some cases, which is necessary. So the technology is there. On the top right, you see just evaluations of apps for pregnant women and for babies. So there are a lot of apps that are out there that have been graded in terms of quality. Bottom left is a bunch of apps, and they're grading them for diabetes management apps. And so people are doing research on apps and what makes them most functional, and we want to leverage that research to make the best app we can for HHT patients. I'm going to try to keep an eye on the time as I'm going along here. So how have we developed this app? I have to say I have a lot of apps on my phone, but I learned a lot by looking at the research that's out there on medical apps. And there's a lot out there about how to do patient education and interventions, and so the best articles out there really talk about many different approaches to developing a best app. You really need to know about health behaviors, health education, change management. There's a whole literature on stages of change for how prepared people are to be able to change their behaviors. It's really important to have clinical guidelines to use, so that you have a resource. You don't have to invent the wheel. You got a resource about what needs to be done for patients with HHT, and you have those guidelines already that have been published for doctors and other caregivers. So there's a literature on app development and best practices that we hope to incorporate, and a lot of user experience principles. We know that if it's a bad app, that people will use it once or twice, and then they will abandon that. So we've partnered already with a mobile app developer. I spoke with several, and we've partnered with a mobile app developer who has experience doing mobile apps, and I think we'll bring a lot to the table. But the illustration there shows is from an article that we cited that talks about how to develop a healthcare app, and Seth, the medical student that I had been working on, really thought that was helpful. We presented at the HHT organization meeting, and it was kind of a nice model here, where in the top left you talk about, well, what are you trying to do with an app? What's important for patients with HHT? So what outcomes are important, and how are you going to measure those outcomes? And then you figure out, well, who's involved, who are the stakeholders, and what are you trying to do? And then from there you figure out, well, what do they have to do? What are actually steps that people need to do to that an app may help empower them, engage them, and motivate them to go through those steps. The multidimensional profile is another verbiage, but it just means that it's tailored to the person. So if you don't have pulmonary AVMs, You don't need a bunch of reminders about pulmonary AVMs. And then you want it to be evidence-based, guideline-driven. The EBG is evidence-based guidelines. So again, we've talked that we have guidelines already. And once you've gone through this cascade of logic and thinking about it, then you can start thinking about the features that you want. And I'll share with you some of those features, and maybe some screenshots in a moment. This is from that article. Just re-emphasizes that point that we really want to know in the business lingo, like, what are the value drivers? What are the outcomes and metrics? I found the article kind of dense and written in business speak, and so when we started looking at this, we just translated it to, like, what's important? What's important for HHT patients? How do you measure what's important? Who's involved in the behaviors, the tasks that need to be done? What needs to happen? What are the essential behaviors? What are the reminders? What do people need to do, and how can we support them with an app? And then how do you individualize it for each person and their needs and where they are? You know, both in maybe their age and how much they're bothered by their HHT at a younger age, at an older age. And then how to intervene is based on the guidelines. And so the guidelines are several years old, but I really find them extremely useful and pertinent now. And quite helpful. So I know that other ENT doctors and other specialists will, still find them very useful, and that can guide us in terms of how to build an app. So you all know this perhaps, or a lot of this already, but maybe not all of it. So it doesn't hurt to review it. What's important? Well, we want to provide value. So value is sort of quality over cost, if you really think about it. But patients want to decrease their medical risks and not spend a lot of money maybe doing that. Some of the biggest risks are the risk of brain abscess, bleeding the brain, or stroke from having pulmonary AV malformations. Small risks each year, but we know those are the really important things that nobody wants to go through. We also want to improve day-to-day quality of life, and for many HHT patients, I know as an ear, nose, and throat doctor, that's nosebleeds. I know that patients bleed every day, or sometimes several times a day, or occasionally a cup of blood at a time, and so we know that's a big part of it. Anemia and just how tired people are when they're anemic, or the need for transfusion, their energy level. We want to improve their engagement in their own health care, because we know that for any chronic disease, patients that are engaged in their own health care they just do better. And then, of course, if we can improve people's quality of life, hopefully they can, stay gainfully employed and achieve all they can achieve in life. So these are what's important. These are the big ticket items. I know there's more than that, but how to measure it? Well, in the short term, we can just measure how knowledgeable patients are, and frankly, how knowledgeable their physicians are. So we will actually try to provide some method to educate physicians with this app if we can. We know that on intermediate term, decreasing their nosebleeds, increasing their blood counts, increasing their energy level, making them more aware of the disease, and keeping them in good communication with their providers is important. And then long term, we talked about some of the other complications, serious complications, and then just being able to maintain your current employment is certainly important to patients with HHT if they have severe HHT. It's important to, as you build an app, to figure out, well, who's involved in this app? Is it just patients? When you think about it, it's not. You really want to try to provide support to the patients, to their family. If we can provide information to primary care doctors or specialists with this app, and we'll show you that in a moment, by giving patients an ability to send a summary of their HHT data, that would be great. Eventually, this may be a research tool, but not immediately. And certainly connecting them with Cure HHT and other organizations can be very helpful, and they're part of the stakeholders. What needs to happen? Big categories. We know patients may not know if they have the disease, so confirming the diagnosis, and then helping people seek care from experts in the field. And you all are lucky that there are so many HHT centers already. but not everybody lives 10 miles away or 50 miles away from an HHT center. So educating yourself about HHT, and the app has potential to help people educate themselves on HHT. We want that people understand what the appropriate screening tests that need to be done and when they need to do it, so that they can then pursue appropriate specialist care. And we can certainly tell people where some of those HHT or all those HHT centers are. We want to be able to individualize this already. We talked about it. We want to customize notifications for people. We want people to be able to track their disease manifestations. We really want people to be able to track their nosebleed severity so they can report on that, certainly track their blood counts. And we want to provide patients with a checklist of things that they should be doing once, or things that they should be doing every year or every 3 to 5 years, so that they can stay on top of the disease and managing it. And we certainly would like to help them educate their other specialists that may not see any other patients with HHT, and we'll talk about that in a moment. So what are some of the things that, and we'll talk in much greater detail in a moment with some of the things we do, but broad categories, we can help people monitor their disease, their blood counts by just entering that manually in the app once in a while, their hemoglobin, their iron levels. We can show how their energy levels correlate with or map to their blood counts, or how perhaps an intervention for nosebleeds leads to less nosebleeds or a higher blood count. We can notify people and coach them on things they need to do. We can encourage them. We can help them communicate with their providers and connect them with other patients. So those are some of the big categories of things that we can help people do. So what are the features that that we look at in healthcare apps, and how do we apply them to an HHT app? And so here are some of the big categories of things that we can do, and we just had some examples here. These aren't from the app because the app is not made yet, but we know we can educate patients. We know we can educate patients about pulmonary AVMs and GI bleed and brain manifestations, nosebleeds, and you know some of these things already as a patient with this disease. We know we can remind them about essential behaviors, the things that they should be doing on a regular basis when they see their dentist, or to screen for pulmonary disease or other manifestations. We know that we can give them checklists so that they get at least one screening study to look for brain malformations, or they get an echo bubble study to look for lung AVMs. So we certainly know that patients need a primary care doctor, right, with this disease. We can help people monitor their disease. They can keep track of their symptoms and their blood counts, their energy level, and they can keep track of their data using this app. So we want to be able to have them take a picture of the report and just keep it in the app. So if anybody asks them about a report, they can bring that back up. Here's this example of self-monitoring energy level or blood counts, as I talked about. We know an important part of the app is coaching people, trying to do an intervention, trying to get them, motivate them to do what they need to do. So we know that we can give them a notification saying, you're 35 years old, you probably need a yearly hematocrit at this point, and those sort of notifications about screening tests. We really would like to make the app, if at all possible, and it's possible with this care kit, to summarize a patient's care, and we don't want to send it to their doctor because we don't want to get in the middle of any privacy issues, but we can have a button that the patient sends a copy of their summary to themselves, and then if they decide to send that out to other people, they can do so and have complete control over that. We know that we can get people involved with their providers by just helping them collect the lists of all their providers and their contact information. So that's pretty standard Apple functionality right now. And we know that we can help build community through Cure HHT and other organizations. And then finally, this is not a feature of the app, but we know that Cure HHT is looking at a registry where patients and providers can register patients and how they're doing clinically and their outcomes. And so this could work well with that, but that's not part of the original, the first first stage of an app. So those are some of the pieces, and where are we with the app? So we have interviewed several app companies. We really have a high-level document looking at the app features, and there are a few considerations that, for those of you on the phone that are pretty techy, let me tell you about some of those considerations. So, first of all, a good app is expensive to make, no question about that. The second thing is, like a lot of people say, well, why not make an Android app? I don't know if you've caught on, but I've really been talking about Apple all along. So Apple is much better suited for healthcare apps. Android devices are all different types of devices, all different sizes, all different operating systems, and they don't have the privacy and security features that Apple has in their care kit. So to keep costs down and to really get something out there for people to use, we will be limiting to Apple iOS devices. They really address the privacy issue, and it will be just an app. It won't be an interactive app where there's updates every week or every month. But there's no database in the back end. But we could talk about that in the future potentially if the organization wants to pursue that. So that's a little bit about the app. Let me back up. I'm sorry. We presented this idea at the fall meeting of the curehht.org, and I think we were really pleased with the response. We got a lot of questions, a lot of people excited about it. As a doc, I was surprised. A couple of older patients came up to me and said, you know, my 25-year-old, twin 30-year-old boys just are not doing what they need to do, and this couple thought that an app might be sort of getting them where they live and getting them engaged with Cure HHT and getting them to get their screening tests. So I thought that was interesting. So we have identified some donors. Marianne Clancy and Nicole from Cure HHT can talk more about that with you individually if you're interested. They've raised some money. I know they can always use more donations to support this sort of thing, and we'll talk about that. Part of today is like to collect more feedback from folks at the question and answer session and with a little survey afterwards. And then I'll be working with Marianne and Nicole from the organization to get a small group of people together as advisors, and then contract with the vendor, finish up the contracting and get building on this. I'm really excited to get going on this. So I talked a little bit about Apple. They have this care kit, it's called, and you can Google this if you're interested and see what people are doing. They have some nice videos. I encourage you to Google it and look at some of the YouTube videos on care kit. But it allows you to track your symptoms, so you can track your energy level, track your oxygen level. We're not going to probably measure blood pressure, but hematocrit, iron level, and you can enter these things in the computer. You can take pictures of your reports. It's just part of the care kit, so it makes developing it much easier and less costly. You can take a picture of your CAT scan, your MRI scan, your other reports, so you have them all in one place. Take pictures of interventions that may have done if you had any kind of surgeries or interventions. We really want to overlay people's blood counts with interventions, so you can say, I had this intervention for my nosebleeds, and look, you can see my blood counts went up, or my oxygen level went up, or my energy level went up, because that's motivating the patients to see that there was an intervention and an improvement. And with the connect part of the care kit, really allows you to connect to your, basically add your providers, connect your providers, and share your information with your providers in a secure, confidential way. Which, again, if we didn't have care kit, they'd be starting from scratch programming this. It's still hard to program this and time-consuming, but and a lot of testing involved to make sure it works well. But the app will be evidence-driven. We've talked about already. We've got these guidelines that have been out there that doctors have been using for years, but that we'll do that. And then I'll stay on the slide for a while so you all can read it. I tried to, in a slide that's way too busy already, talk about some of the functionality that we've discussed with the vendor. If those of you who have used apps, I imagine many of you have, But if you have any, of course, you want to know who the app is registered to, and just adding telephone number and contact number and that sort of thing. You want to add your doctors on the top left, and the profile. Again, I just made this very brief. You want to collect data like, does somebody have lung AVMs or brain AVMs or gastrointestinal AV malformations? Have they had the screening tests? Have they had any embolization? So if you know what people have, then you can give them the notifications later when they're due for a repeat study to be done. Bottom left there, ongoing reporting of tests and patient-reported outcomes. We can have patients report and just add their blood level tests, their iron. We've got a pretty neat way of people recording their nosebleeds either day by day or week by week or month by month, their oxygen level, their energy level, blood transfusions, those sort of things. They're pretty straightforward data entry. The real cool thing I think about is just notifications. So, if it's been 3 years since you got a screening test for pulmonary AVMs, we can remind you. If your blood counts are dropping, we can remind you. If you don't have a primary care doctor but you need one, you have an ender one, we can say, hey, you probably want to do that. If you need directions on how to go about finding an ear, nose, and throat doctor or a center, we can link you to information to provide notifications. And then, of course, the possibility of doing education. In the bottom, in the center right, what are the screening tests? What do they involve? Where do you get them? And what do they mean? We wouldn't want to deliver a book by the app. We can link people to websites, but some basic information is nice for people to understand how the disease can be managed. And then I like the opportunity to say, hey, I got a new doctor, I just moved town, let me just send a summary of my HHT story to a new doctor or a new specialist that I'm working with. So I think that's a neat, I'll go back to this, a neat potential for the app. I'm a techie. I sometimes find I have 40 apps open on my phone. I got to close them all one at a time. I don't know how many people are out there that like me, but I really feel like it's very likely we'll get some engagement of folks that might be younger and a little less worried about the disease and not engaged and not doing the screening tests. And I think it's really important to try not to miss opportunities to do screening tests and prevent problems and complications. It's all part of that education. So I'm really excited about it. I know the company that we're have worked with is Arbor Moon. I think they're on the line actually today. Hello, Peter. I know they're excited about it because they, like many people, get really excited about healthcare and the opportunity to help people. It's one of the reasons I like my job so much. So I think in a moment we'll have some time for a discussion. I thought I would just maybe put some questions out there, maybe pique your interest. Certainly we can talk about what else you'd like to see in the app. I may go back to that list of features so you can read it and think about it. There may be some concerns about an app that we haven't thought about. I think privacy and security are pretty tied up and pretty good with this, but maybe there are other concerns. Are we missing some group of people or some provider group, doctors that we should be thinking about? Are there opportunities we're missing? And I'd be curious if any of you have the question or have an answer to the question. Do you think an app would get younger patients engaged earlier? And then finally, for those of you who might be really, as I say, geeked about this, really excited about it, and if you want to participate more or contribute to this, I'm sure that the Cure HHT can use additional funding for this. Apps are made and then they're updated and more functionality is added. So if this takes off and people like it, I know there will be requests for more functionality. I've already heard those. So if you're interested in this and contributing or donating, please let Mary Ann or Nicole know. I think their information is on the next slide. If you're not tired of looking at my mug already, there's another picture. Nicole's email is there. My email is there as well. And I hope I think there's some people from Southeast Michigan in there. Go blue for those Michiganders. And I think Nicole might have another survey question or poll question, and I think we can open it up to questions at this time. Nicole?
Yes, thank you so much, Dr. Terrell. And so we are actually launching our last poll for the evening, but I wanted to thank you for an exciting look into the development of an HHT app, and we are eagerly waiting for this concept to become a reality. So before we begin the question and answer period, I want to remind everyone that there are several questions regarding the functionality of the HHT app included in the survey that you'll receive after the webinar, and your feedback is critical to the next steps of development. So please take a few minutes to complete this survey. So our first question for the evening, and we've had a couple of people ask if this would be available in all countries, and if so, would it be able to help with resources in those areas?
Well, I think there'll be a potential language barrier, and I believe I can speak for Marianne and Nicole saying that we do plan on making it available in the Apple store, and I believe the goal is, and it was on my slide but I didn't speak to it, the plan is to make it free to people. So if you have an Apple device, it should be easily usable by anybody, but it will be in English to start off with. Again, anything's possible, but Peter, I don't know how many languages you speak.
Okay. So the next question is, someone asked if there would be a section to include medications.
I think that's a good question. I think we considered that there are a lot of apps out there that that deal with medications already. There's some really good ones out there, and I didn't want to reinvent the wheel. I think that many patients are on. You'd be surprised how many patients are on 5 or 10 or 15 medications, but I think you'd find that very few of the medications are for HHT specifically. So I probably would rather focus more energy on something for HHT, although again, if there's a demand for adding medications, the CareKit app could do that, I think, very easily, and anything's possible.
Okay, great. So I have someone who has been gathering information, data about his wife's HHT condition for years, and would like to know, is that beneficial, meaning his CBC, surgeries, operative reports, educational documents, how would that be utilized in this app?
Right, so the CareKit, this is why I love Apples, right, because they have already functionality in CareKit to say, take a picture of something, take a picture of my hand, but you can take a picture of the report, and not the images themselves, because that's way more complicated. There are apps that do that as well, but at the very least, the report that would show whether you do or don't have something in the lungs or the brain, or you can take pictures of blood counts as well potentially. Blood counts, will probably have just a way of scrolling and entering your blood count so you can track it numerically. So it's hard to track blood counts if there's a picture, but you'd enter your blood count so you can track over time how that blood count is. So old data could be, we're hoping that you can take pictures of old studies, old reports, so you don't have to run around with reams and reams of paper. Although I love the idea of keeping a notebook so you have everything organized as well. They're probably complementary.
And this would be something that the individuals would take this documentation and put into the app, correct? It will not go through the foundation.
Oh, that's correct. So it's everything is going to be done by the individual. It's really we would make this app much more complicated if we had stuff coming in over the internet, wirelessly to the app, or if we sent things out. There's a lot of privacy and security things, so that makes it so much more complicated. Again, we want to start with basic and get there, baby steps. It is a lot more complicated to receive or send stuff. But the summary score and the summary of your data could be, again, with CareKit, you can send me a copy. And we intentionally said send a copy to the patient that has the app rather than trying to send it out, because people do worry about their privacy. And if it's just your email address is on there and it says only send it to you, then there's much less worry about that.
Okay. So the next question says, is there any work being done to make sure that certain fields are consistent with any future integration with the HHT Outcomes Registry?
I think that would be good. I haven't seen the, I know there is a registry and it's been working. I don't know enough about the registry, but I'm a big believer of beginning with the end in mind. And so if the registry data fields are out there and we can make sure that the disease registry fields are very similar, then I expect we could build this in such a way that eventually data could be sent to the registry. But again, that's that next level of privacy and security and would require substantially more development to and permissions and that sort of thing to send data out of the app.
Okay, and I also want to let you know that Peter has responded to the language and country issue, and they are very familiar with localizing apps to different languages.
Oh, good.
Okay, so the next question is, can we track our own numbers and compare it to the general HHT population?
So that would be difficult with the app as it stands now, because again, we're not sending data out. I think it could be something in the future. I'm not sure if we do that through the app or through the registry, and I'm not sure of the people on the line, how many people know about the registry, the detail, but I think that would be more likely a tool that might get developed faster through the registry than through an app. I don't know if any of you all looked at Patients Like Me. I think I looked to see if HHT is on there, Patients Like Me, where people with the similar diseases talk about these sort of things and compare their experiences. But if you're interested in that, that's another website that does something like that.
Okay, and it is something that the HHT registry will be able to do, that you will be able to compare your own numbers to the general HHT population with the outcomes registry. So the next question is, an individual is on Coumadin due to clotting and they would like to track INR with other data. Is that going to be possible?
Yeah, I mean, again, anything is possible. I guess we might think about the 80-20 rule. Like, I don't know what percentage of patients with HHT are on Coumadin, which for those of you is a blood thinner. I guess that should require that maybe that stakeholder group to sort of think about that. There's building an app to follow anticoagulation. It would probably might be more than just monitoring one's INR. It may be monitoring their diet, their other medications, interactions with other medications. So I can imagine that we call it scope creep, turn into another whole app on its own, or could be redundant with an existing app. So that's a great question. Probably just adding INR would be something that could potentially be done if it's just add the INR value. Be pretty straightforward, I would imagine.
Okay. Will the app be available on a PC in addition to your Apple phone?
No, right now again, each one of these things is increment, sometimes double the amount of time and money. So it will be on an iOS devices,
Okay.
Apple devices.
Okay.
But not like a MacBook or a MacBook Air.
Okay. And will there be a beta version available to use before the app is actually put out on the market?
I'll let Nicole handle that one. If there are people that are interested in beta testing, maybe they can email Nicole or me. We will need people to test, but I'll have to get into that later, I suppose.
Okay. So the next question is, how long will historical data be available on the app?
How long will historical data be? I guess you could go backwards and say a test was done at a certain date by just saying when the test was done. I guess as long as the app is out in the App Store and available, as long as it's supported somehow. I mean, so the operating systems. I wish Peter were on the phone. I could hit him with some of these technical questions, but the operating systems change Apple every year or two, and so as I understand apps, the apps need to be maintained as well. So you can develop an app, but then with every operating system upgrade, you need to upgrade that app to make sure it stays current with the operating systems. And so as long as there is an organization and a will and financial support to just update the app, hopefully it will continue going on indefinitely. But that's for us to find out based on the people voting with their fingers, I guess.
Okay. And will there be a way, I know in the presentation you said you can share information with your family, but is there a way that a family history could be connected through the app?
Oh, that's that's certainly possible. Sure. I mean, again, I think there are apps out there that collect family history, so you could. I guess the simplest thing you do, you could draw out your family history and just take a picture of it. And that would be one way of doing it. Or you could have a data entry field. So we didn't sort of put that in our first iteration of that, just because we thought some other things probably more valuable. We'll hear from you guys. But yeah, people have made those sort of apps already, and something that could be done, not as a first stage probably, but let's see what people say.
Okay. So how long do you think it'll be before the app is available? One is a beta test and two is widely available.
I would like to tell you I know the answer to that, but I work at the University of Michigan, which is one of the biggest organizations that's very complex, very complicated, and I always underestimate how complex and complicated. I mean, I'm sure there's some contractual negotiations need to happen, probably some contracting and a little bit of legal review. So I think it depends on how fast we can get some of the paperwork done. And then Peter told me, they used to making apps and they can make them fast. So but it's several months to make the app.
Okay. And I would imagine that a portion of that timing has to do with funding, as well as a development team to try and, do the beta testing and get the questions and the feel that you want that you've displayed on here tonight.
Yeah, absolutely. So, I mean, Nicole and Mary know we've been talking about this now, and we've learned a lot. I've learned a lot over the last 8 months, but we've been working on this already for eight to 10 months. So we're ready to go, but funding is a key part of it. So we definitely want to reach out to people and to help fund this as well.
Right. Okay. So so how can people help to get this started? I think that you've said that they can email us if they're interested in being part of a development team or on a beta testing team, and obviously they could help by donating to this particular program. Any other ways that people could help move this forward?
Remind me, Nicole, now, if they decide to donate, if they go online, can they donate and target their donation to one particular area of Cure HHT interest or another? Could they target it towards the app if they go online?
Yeah, so if they were to make a donation online, there is a comment box, and they could say HHT app in that comment box. And there will also be on the recorded page of the webinar, there will be a direct link to that donation form with some instruction to that effect.
Great. I know that we're starting. I know there'll be well, just based on my experience with people and apps and how they're excited to get about it. I know there'll be, and thank you for the folks on the phone already. there'll be a level of enthusiasm and like, can we do this? Can we do that? The hardest question is always is not what to say yes to, it's what to say no to, because there are always good ideas about things to add, and it's been hard to even narrow it down to this scope to get this started, because Seth and I and Marianne and folks looking at this, we have thought of a lot of things already, and trying to keep it within scope is always the hardest thing to do.
Great. Well, I think is there any resource of government funding for anything like this? And I would say the answer is no. But what would you say?
Well, government funding is occasionally there are things that come out, and I think you guys actually stay. I mean, you guys are very politically active and probably know things about things before I do. The HHT, the Cure HHT organization. Some of the a lot of the funding opportunities take 6 months to draw up the funding, and 3 months to get it reviewed, and 3 months before you find out. So I can imagine trying to go to government funding and taking a year just to the cycle. So I'm a surgeon, so I'm a little bit impatient, and for a moderate amount of money, probably there are much better ways of doing it that are much faster, and that's why we're raising money through HHT.org.
Great. Okay. And I just think it can't be mentioned enough that people just need to share this webinar with their family who's not on the call. When you do get the email to follow up with the recording, or they can go to our website. And particularly, as you mentioned, for the younger generation that might not be as engaged in their health care, that this is how they operate, and we're trying to reach to that generation as well. I don't know if you want to speak a little bit more to that.
Yeah, I think there are lots of studies that show, throughout the world that this is where people are spending. I mean, it's amazing the amount of time. I mean, I think there's studies that show that the average person spends 2 to 3 hours on Facebook, which blows my mind away. But it lets you know where people are spending time, and it is the younger generation. It's the millennials, and well, it's my generation as well. What am I saying? A lot of people, like to get little bits, incremental information, and I think, little notifications that pop up and remind people to exercise, or remind people to do health, to follow healthy habits. They are effective for folks, and getting those little bits of information. It's non-threatening and it's engaging, and a lot of people really find it helpful.
Okay, well, that's actually all of our questions for this evening. So we're just very thankful for you coming forward to us with this idea. I think well over a year ago, or maybe a year and a half ago. And so it's been a project in the works for quite some time, and there is light at the end of the tunnel, and we're just extremely excited about that. And I think the community will be too. Once we get to a point of being able to share it more with them. So again, just thank you for spending your evening with us tonight. And I just want to say to the community on a whole that we have a shared goal to advance one common hope: to give those affected by HHT a chance for a normal life. And this webinar series is just one of many ways we accomplish this mission. We're grateful to the donors of Cure HHT for making this and all webinars possible. Please consider donating to ensure we continue to offer high-quality education for you and your families. You will receive a short survey to complete so that we can better serve you in the future. Again, I want to thank Dr. Terrell for leading this evening's webinar, which has been recorded and will be posted on our website at www.curehht.org under the Resource tab. Please share with your families. We truly appreciate your participation. Enjoy the rest of your evening. Good night.